Welcome to the Prescription for Admission podcast, where we talk about hospitals and hospital-based care, who you can expect to meet, and what you may experience during your time in the hospital, both as a patient and also as a healthcare provider working in a hospital. My name is Dr. Monique Nugent. I am a practicing hospitalist and also the author of Prescription for Admission, the book, where I talk about many of the same topics. Thank you for joining me and enjoy the show. Hi, and welcome back to the Prescription for Admission podcast, where we talk about hospitals, all things inpatient-based hospital care, your experience as a patient, your experience as a healthcare provider, your experience as a caretaker in the space of hospitals. I am your host, Dr. Monique Nugent. I'm also the author of the book Prescription for Admission, which the podcast is named after. Consistent branding, right? Where I talk about a lot of the same topics. But the great thing about the podcast is I get to delve into topics a lot more in depth. I get to have really great guests to talk about different facets of inpatient care and the experience of hospitalization. And this is one of those in-between season episodes where it's another solo episode, just me. So I'm going to be your only guest today. And I love these episodes because I've been able to take some time to talk about really high yield points that I want everybody to know about, and also just talk a bit about myself and my experience in medicine. So far in this in-between season, we have spoken about really basic topics, and I'm going to stay on task with that, talking about really basic topics. We covered what types of hospitals there are and how to find out what's in your community. And then we also spoke about the medication reconciliation process, which is a process of comparing the medicines you take, the ones you should be taking, and coming up with a safe list, and why that is so important throughout your hospital stay, and particularly for your admission and discharge. And so now, staying on task with really simple topics, we're going to talk about admission. And I know that, again, someone's going to say, well, of course you're going to talk about being admitted to the hospital. You are a hospital-based podcast. Yes, but being admitted to the hospital is not sometimes what people expect when they come to the emergency department, or however way they come into the hospital. They may not expect it. B, it may not be something people want. C, there may be opportunities to do something a little different to avoid a hospital stay. And D, it may be necessary for reasons that you did not realize. And I want to talk about those reasons and why it's perfectly okay to be hospitalized for things that maybe don't seem as catastrophic. So I think if you spoke to any hospitalist, they would tell you they've had the experience of going to the bedside emergency department and saying to the patient, hey, my name is Dr. Nugent. I'm one of the hospitalists. I take care of patients who need to spend some time in the hospital, and the emergency department thinks you might benefit from some time under my care. And the patient or their loved one would be like, I'm being admitted? What? I don't want to be admitted. I didn't come here to stay in the hospital. And I get that, because a hospital stay is extremely disruptive to what's going on in your world, right? People may show up to the emergency department or their primary care doctors thinking, I'm going to get this care and I'm going to go about my day, and not have made preparations for things to continue going on when they're in the hospital. One of the more common things I hear is, I have a dog, I have a pet, I have someone or something I need to care for that I have not made plans for, and I can't just be yanked out of my reality and plopped into a hospital bed. I have to go and actually take care of things, right? And then there are also people who have financial reasons for not wanting to be admitted to the hospital. People who may have no insurance or be underinsured, people who may find themselves outside of the place where they normally get care. And also, let's again not forget that being yanked out of your reality means that you're not going to work. And there are so many people for which a missed day of work can have significant financial implications, right? So it's totally understandable that coming to the hospital thinking I'm going to get help and it turning into now I need to stay is not a welcome experience, right? And it's the same thing. I'll have friends or family members call me and say, oh, we're heading to the hospital for X, Y, and Z. And I say, well, what do you think is going to happen? What are you expecting? And they say, oh God, I just hope they don't admit us. So why is admission necessary, right? Is the question. What makes that emergency medicine physician? What makes your primary care doctor in the office? What makes your oncologist in the office? What makes your podiatrist in wound clinic or your surgeon who has seen you for a follow-up? What makes that person say, hey, you need to go to the hospital for continued care? And it really falls under like two buckets. The number one thing is safety. Are you safe? Did that lab value come back and prove that you need to be seen in the hospital and cared for because your hemoglobin is too low, your kidney function has gotten really bad and needs to be, addressed and possibly assessed for dialysis needs? Is there something going on? Is that wound infected and needs IV antibiotics? Is there something going on that makes you unsafe to stay in your environment? That is the number one reason that emergency medicine physicians and other healthcare providers will contact me. They will say, this patient is just not safe. And safety means a ton of things. I just listed a whole bunch of medical interventions that may be required, right? Dialysis is a huge medical intervention. If you need to start dialysis, it's a thing, right? It's a process. But there are other reasons why people are not safe. And something that people don't realize is that it doesn't take like a lot to be unsafe. So you come to the emergency department, you feel a lot of nausea and vomiting. Oh, I'm just going to go in and, get some medicine, a little bit of IV fluid, and I'll leave and go home. But if you can't stop vomiting, if you can't keep food and water down, how are you going to maintain hydration and nutrition when you leave the hospital, right? So somebody who can't tolerate food and water, that is an unsafe enough environment or situation where you might benefit from, maybe a few hours in the hospital where we can further give you some care outside of the emergency department, or even, a day or two to make sure that you're getting enough IV fluid to support you and you're not getting dehydrated while we figure out and help you to stop the vomiting, right? Walking. Now that sounds really simple, but if you are too unsteady to walk, you are not safe. And I know that sounds like kind of judgy. I've had patients say that to me, like, oh, you're just judging how I walk. But the last thing that we want is for you to fall down, get injured, and have a worse situation than the one that is currently bringing you to the hospital, particularly for our elders. Falling down is a really traumatic event that can cause significant injury and cause significant changes in people's lives, right? And so if you have an older parent, someone who you're caring for, you bring them in the hospital, they're unsteady, but they normally live alone. That's something that the emergency medicine team is going to perk their ears up and say, like, the patient can't walk. The patient is not stable. They're not safe to be in their environment. That doesn't mean that you're going to stay in the hospital until you're ready to run a 5K. No, in no way. But it does mean that you need a little bit more care, right? And so just really think about when you go into the hospital, if the emergency medicine team says, hey, we think you need to be admitted. If someone like me, a hospitalist, shows up and says, hey, we think you might benefit from some time in the hospital, and you're on the fence, the first thing I want you to think about is, am I safe? Am I safe to be at home in my environment in the way that it is? Because we may be able to change things in your environment when you're in the hospital. I can work with the case management team and have a hospital bed delivered. We can get you a walker. We can do a few things to help change your environment, so that you go home, you're a little bit more safe. We can get you hooked up with Meals on Wheels if you're not able to cook for yourself. We can get visiting nurses to come in and check on that wound. But if you don't have those things like now, and you're trying to leave the hospital, it may not be possible to get those things now. And so I really want you to think, am I going to be safe in my environment when I leave here, right? That is going to be the first thing. And if you're caring for someone, I want you to think about that as well, right? Try not to have this superhero idea of I can do it all. A hospital is a great place to get a little bit of respite, a little bit of support, a little bit of extra hands while you plan the next steps. And if you're a caretaker and you really think, I can't care for my loved one at home, currently the situation that we're in, that is a good enough reason for an admission. Safety. Safety is the number one thing, right? Now, the second thing I want you to think about when someone says, oh, we would like to admit you to the hospital, the second thing I want you to think about is access to care. Can you get the things you need if you leave here, if you leave the hospital at this moment? And that means things like access to whatever specialist you may need, access to your primary care doctor, but it also may mean access to medication. Can you get the medicine? Is the medicine that you need, is the antibiotic that you need available, A, in pill, and B, to you? And by to you, I mean, do you have the insurance and is it covered? And, does the pharmacy have it? Like, there's so many things that go into accessing a medication. And I just picked antibiotic, but it could be a lot of things like anticoagulation, right? So make sure you can access the medicines that you need and the therapies that you need and the professionals that you need. So in my book, the Prescription for Admission book, I address this and I say, hey, there's actually a lot of care that happens outside of the hospital. Ask about that. And I'm going to stand on that and then also update it. There is a lot of care that can be done outside of the hospital, right? You can get IV antibiotics at home through different services that can deliver them and visiting nurses who can help give them. Some people are able to do it themselves after training. I can't tell you how many patients I've met who have daughters and sons who are nurses or somehow, working as healthcare providers who are able to, oh yeah, we can do that. That's easy. Things like that. There's a lot of wound care that can happen. You can even go home with different equipment for wound care. That, wound vacs, you likely have to have that set up in the hospital or in clinic. But what I'm saying is that type of stuff can happen outside of the hospital. There's lots of care that can happen outside the hospital. Physical therapy can come into your home. Occupational therapy can come into your home. Oxygen. We can give you oxygen at home. Oxygen is a life-saving medication, which should be on your medication reconciliation list. So add that to the bottom of your list right under Lasix, like how much oxygen you use. But we can do all of these things. We can do a lot of things. We can help people be in their environment and get a lot of care. Tube feeding can happen at home. End of life care can happen at home. And so ask, if you truly feel like you can deliver yourself the care or have that care delivered at home through different services, ask the case managers, what is necessary to get those things? Oh, the doc says that I need X, Y, and Z. Can you check if my pharmacy covers it? I'm trying to see if maybe I don't have to be hospitalized. And if you're able to do things like get next day appointments with your specialist, right? You call your cardiologist, hey, I'm in the emergency department and they would like me to see you tomorrow. You may be able to see the cardiologist or their NP or PA. A lot of outpatient programs have built robust supports for their patients to keep their patients out of the hospital and to help you get the care you need. And there's also a program called home hospital or hospital at home, depending on which service is running it, where hospitals can deliver inpatient level care at home. And so this is a part where I said, I'm going to update that statement. So let's talk about what home hospital services are. And then we're going to go back to my update really quickly. Home hospital services are services where hospitals say, hey, we can take care of patients in their home with a list of things that they've got going on because we can deliver the same medicines that they would get in the hospital. We can have nurses come and see them on a regular basis. We can get them radiology. We can have visits, virtual visits with specialists. We may be able to get them therapies, all sorts of things. We could do essentially everything that we do in the hospital, we can do in someone's home. And a lot of hospitals built out a decent infrastructure for this. Now, why is this an awesome program? This is an awesome program because number one, patients love it. People don't like being hospitalized for every reason that I said. And I once listened to a hospital at home director speak really passionately about the experiences of their hospitalized patients, their home hospital patients. And one was speaking about really some cultural differences, that this was an older lady with dementia. She didn't speak English. And so being able to be at home with her loved ones who could speak with her, who could feed her foods she was culturally used to, versus being in the hospital and like getting whatever chicken salad sandwich that the hospital is serving for cold lunch that day, that this patient did really well with home hospital-based care. And she and her family were through the roof with the experience because they felt like she didn't have to leave a place she was really comfortable and cater to and go into a hospital where the transition is often really bumpy and sometimes can have, like I said, those disconnects with what patients are comfortable with, right? And I thought about that. I was like, that is an amazing program. And I have actually done, not many, I've actually participated in a few home hospital shifts. And I can tell you the patients were really excited. They were catered to in their home and they liked having a visitor and they liked chatting with me on the television. And even though it wasn't a program that I was able to participate in as often or as fully as people who were dedicating their practice to this, I saw real value in this. And it was something that I really encouraged people to say, like, hey, if you feel like you're going to be hospitalized, ask about this. See if this is an option. And there's lots of reasons why it may not be an option. The number one reason is, again, safety. If you are not even safe to be out of the hospital because you are, clinically unstable, there are things that are just not able to be delivered in the home hospital program. That's a great reason not to be there, right? Not every patient. In fact, it's going to be a pretty small number or percentage of patients who's going to be able to fit that. And so I mentioned that in the book. I say, ask about home hospital-based programs, ask about home health programs, ask about what can be delivered in home. And so this is where we get to the update part. Hospital at home programs were funded through a waiver by CMS, Centers for Medicaid and Medicaid Services, right? And that waiver was not renewed. So what does that mean? That means those programs were not able to be paid. And so nobody likes talking about money when it comes to hospitals. I particularly don't like having that conversation because sometimes people will say like, oh, well, hospitals are just, billing for this and billing for that. And that's a totally different conversation. But the truth is, you still have to pay the professionals who are doing the work. You still have to pay for the medication. You still have to pay for the delivery of things. And so it is necessary to pay for care. And a lot of programs built really robust ways to support patients in their homes. And when that waiver was not renewed, that means that they were not funded again. Now, does that mean these programs were shut down? I'm going to say no, not particularly. I'm not going to speak for every home hospital program in the country. And again, it is not my lane 100%, but I know that a lot of programs had to find different ways to care for those patients or had to decide on, are we going to continue admitting patients? And so this kind of changes part of the book. And for the first time since writing the book, I feel like something in the book is dated. And I don't know how long that's going to be not funded. I don't know if the program will come back or not. I can say that there's a lot of benefits to it, not just all the experiential and clinical benefits I spoke about, but there's also financial benefits. Not having to pay for the overhead of a physical hospital every day does also help with lowering cost. And it is a way that care is delivered in other countries as well. So this isn't something new that we were out here like on a limb figuring out. This is a way people have been cared for a while in other countries, and it has worked. And so I really hope that they somehow decide in the future that it is something of worth for our patients here in the United States. This is hard for me to talk about. I don't know if everyone can hear the hesitation in my voice, because this is a pretty new podcast, and I'm trying to be very transparent in this moment. It's a pretty new podcast. I'm still trying to figure out my lane and how to expand that lane and how to turn in that lane and things like that. And getting into healthcare policy is, although something I love personally and professionally love to talk about, I haven't really figured out how well to do that here, right? But healthcare policy dictates how we deliver care and to who we deliver care. And there's conversations right now in this country about that, who we should be delivering care to and how we should be delivering care. And it's becoming a little difficult for me to shy away from having at least acknowledge it. And so this is the first time on the Prescription for Admission podcast where I have said the word policy and funding. And it's not because I have an agenda. It's because I want you to think about the experience of hospitalized patients. The hospital is essentially like the DMV of healthcare, right? Everyone is unfortunately going to show up there at some point in time, and people are not going to be excited to be there, right? And there's going to be too many people, and people won't know where to go and what papers to fill out. And that is the truth. That is oftentimes the experience of people who are hospitalized, that they feel like they don't know where they're going and what's happening. And how we support hospitals and how we support the people who need hospitals is really going to determine the outcome of each and every person who comes into a hospital, which in the end is going to be each and every one of us for some reason. So I myself have had 3 children and have been hospitalized for those 3 children. I have not had like a medical hospitalization, but my experience as a pregnant woman, my experience as a Black pregnant woman, my experience delivering babies in a hospital very much was dictated by a lot of the legislature around healthcare and hospitals and pregnancy and all of these things, right? And so the home hospital program is a program where people are able to get care in a different venue. They're able to get hospital level care in a different venue. And I openly encourage people to ask about ways you can get care in your community. And I'm not just speaking only about hospital at home programs, right? You may be able to hobble together, visiting nurses and supports and infusion clinics and primary care offices and all of those things. There's so many ways you can be supported in the community. This is another way we can support patients, hospitalized patients, or patients who need hospital level care in the community. And I just really hope that they figure out how to continue this program, because I think there is a lot of benefit. And so if you get to the point in your hospital stay and you need to be hospitalized, you figure out I'm not safe, or they think I'm not safe, and everyone comes together and comes to a conclusion that you're not safe, or there's access to something that I need that I can't get in a timely fashion, or I can't get in a safe fashion, or I can't get at all. And so, hey, I need to be hospitalized, or we can no longer support the person we're caring for at home. It's no longer safe for them. It's no longer tenable. We need a plan. And you decide to be admitted to the hospital. Ask about other ways of delivering care if that's on your plate. And it may not be on your plate for lots of reasons. Some people may just feel really, really unwell and not want to leave the hospital. And I think honestly, for the majority of patients that I come across, that is the experience. I would like to be hospitalized. That's why I came here. But I'm trying to have the conversation to say, like, if you're questioning, do I need to be hospitalized? This is your thought process. This is what I want you to run through. Safety and access and making a plan. And then if you're like, I'm on the fence, the team is on the fence, maybe we can do something else. Ask what else. And one of the things that was able to be asked what else was an option was home hospital services. So I don't know where we're going to come out on that. And if anything changes, I will try to keep you guys updated, but still ask. I don't know where every home hospital or hospital at homes program in the country has landed. I have no idea. Again, not 100% my lane, just a program that I really felt passionately about and excited for hospitalized patients to be able to have access to, right? And even if they're like, no, we don't have that program, or we've never had that program, or we had to, pivot with that program, we had to close down because of funding, they may still be able to give you access to things in the community. There are lots and lots of ways we can support patients in the community, and that support can be a lot more robust than people realize. One other good reason to be hospitalized is planning, right? If you can come into the hospital, get stabilized while we make plans to help you get the things you need to be successful out of the hospital, to me, that's a great reason to be hospitalized, right? And there's going to be someone listening who's going to be like, well, what about inpatient level of care and outpatient level of care? I 100% promise that we're going to get to that conversation as well, because you do have to meet a certain level of need to be in the hospital, right? But if the emergency medicine team is saying it, if your primary care doctor is saying it, if I'm saying it as a hospital-based physician, as a hospitalist, it's likely that you are already there, right? So I just want you to think, is it safe? Can I get access to my care? Can I hobble things together as an outpatient? Is it going to take just a couple of days for me to get those things? When I was a younger physician, I kind of really balked at like what I call, or lots of us call, social admits. But now I understand it. Sometimes you need a safe place to be while you make plans to continue to be outside of the hospital. We oftentimes see that with people who are caretakers, who will say, I can't care for my loved one at home anymore. It's not safe. And the hospital, that's fine. That's a reason we're here, is to help you stabilize, make a plan, and move forward. So that's it. That's what I wanted to touch base on about admissions, right? Now you know what type of hospitals there are. Now you understand why we may say you need to be admitted. Now you think about it and you say, hey, I agree, I disagree, or what can we do for me as an outpatient to help me avoid a hospital stay? Or you're like, nope, please hospitalize me. And then you take out your medication list and you're going to go through that medication reconciliation that we spoke about earlier as well, because you're like, oh, that is a big safety issue, right? And so I enjoy these little one-on-one talks because I like talking about just kind of the basics. It sounds kind of simple to think, oh, do I need to be admitted? Do I not need to be admitted? Oh, the doctor says I need to be admitted. But it's oftentimes a more complex decision for people than we realize. And so I just want to give you guys a little framework to think on your own about, would me or my loved one, wow, I can't speak. Would me or my loved one benefit from some time in the hospital? And how can we take steps to be productive during that time? So this has been another episode of the Prescription for Admission podcast. Again, I am Dr. Monique Nugent. I'm your only guest today. I'm the host, and I'm working on really great guests for season 2 and 3, which I'm very excited about. You can find more about inpatient care in the book, Prescription for Admission, for which the podcast is named after. You can also find me on my website, drmoniquenugent.com. And then my socials, you can find me on Instagram. My Instagram handle is actually different. It is The Happiest Hospitalist, and that's like an old story for later. But I'm also on YouTube, where you can find this podcast, like and subscribe. And then you find the podcast on Apple Podcasts, Spotify, anywhere that you listen to podcasts. And then you also like and subscribe because you love it so much, you're going to come back for the next episodes, where we're going to talk more about hospitals and the experience of being a hospitalized patient, a caretaker, or a hospital-based healthcare provider. Thank you guys so much. See you later. Bye.